Ever pondered if your sleeping position impacts your health? Today, we're diving into the world of stomach sleeping. A significant number of individuals worldwide prefer this seemingly harmless sleep position due to its comfort and the security and warmth it provides. Unfortunately, it might not be as benign as it appears. Let's examine the spine, an essential part of our body that significantly impacts our overall health and well-being. Sleeping on our stomachs unknowingly puts our spinal tissues under strain, resulting in discomfort such as spinal pain, neck pain, and back pain. Similar to the effect of placing a heavy book on a feather, over time, the feather loses its fluffiness, becoming flat and strained. But it's not just about physical discomfort. Did you know those facial wrinkles that seem to pop up out of nowhere might not be so random after all? Sleeping on your stomach can contribute to the formation of these undesired signs of aging. Imagine pressing your face into your pillow for 8 hours every night. Over time, this constant pressure can cause your skin to crease and wrinkle. Despite these drawbacks to stomach sleeping, there might be some redeeming factors. So what could these redeeming factors be? Let's find out. Despite its drawbacks, stomach sleeping isn't all bad news. You see, every cloud has a silver lining, and so does the prone position. Let's delve into the benefits of this particular sleeping posture. Firstly, stomach sleeping can be the unsung hero for those who suffer from disruptive snoring. Yes, you heard that right. This position helps to keep our airways more open, reducing the chances of that dreaded nocturnal noise. Imagine no more elbow nudges in the middle of the night, or frustrated partners exiling you to the couch. What's more, it doesn't stop at snoring. Stomach sleeping can also be a potential remedy for sleep apnea. That's a serious sleep disorder where breathing repeatedly stops and starts, causing a host of health issues. By sleeping on our stomachs, we limit the possibility of our tongue blocking the airway, which is a common cause of this condition. Now let's paint this picture with some vivid examples. Picture a balloon. When it's on its side, the air inside is evenly distributed. But when it's flipped over, the air shifts to the top, leaving the bottom flat. Our bodies behave similarly when we sleep on our stomachs, allowing for more open, unobstructed airways. Similarly, consider a flute player. They position their lips and breath to create beautiful melodies without obstruction. Stomach sleeping can be likened to this, where our body's positioning aids in creating a more harmonious night's sleep. But as with everything in life, balance is key. It's important to remember that while stomach sleeping may help with snoring and sleep apnea, it's not a one-size-fits-all solution. Each person is different, with unique needs and health considerations. The real question then isn't whether stomach sleeping is good or bad. Instead, we should be asking, how can we stomach sleep more effectively and safely? Time to find out. For those dedicated stomach sleepers out there are ways to mitigate the downsides. Yes, you heard that right. It's a matter of making a few adjustments to your sleeping environment. Let's dive into this. Firstly, the choice of pillow. It's best to opt for a thinner one. Why? Well, a thinner pillow reduces the angle at which your neck is bent, alleviating strain on your spinal tissues. This in turn can help to minimize the likelihood of waking up with that dreaded neck or back pain. When selecting a pillow, look for one that is just thick enough to fill the space between your neck and the mattress, maintaining the natural alignment of your spine. Now let's talk mattresses. A firmer mattress is generally recommended for stomach sleepers. This is because it offers greater support to your body, helping to prevent your abdomen from sinking into the mattress and causing your spine to curve. Just imagine a firm, supportive surface that keeps your body in a more neutral position throughout the night. Doesn't that sound like a recipe for a good night's sleep? But how firm should your mattress be? The answer is subjective. It should be firm enough to support your body, yet comfortable enough to provide a good night's sleep. It's all about balance. So, when shopping for a new mattress, don't be shy. Lay down on it, try different positions, and make sure it feels right for you. Remember, these are general recommendations. Everyone is unique, and what works for one person may not work for another. It's always a good idea to consult with a healthcare provider for personalized advice. But what about those who are pregnant? There's a preferred position for them too. Stay tuned as we delve into that in the next scene. Pregnancy brings about many changes, including the need for a new sleeping position. As your body changes to nurture and protect the new life growing within, it's essential to adopt a sleep position that benefits both you and your little one. It is widely advised for expecting individuals to sleep on their left side. Now you might wonder, why the left side? Well, this position improves blood flow to your heart, benefiting both you and your baby. Not only does it ensure adequate nutrients reach the placenta, but it also reduces pressure on your liver, which is positioned on the right side of your abdomen. This position can help alleviate common pregnancy discomforts, such as backaches and heartburn. Remember, it's not just about the quantity of sleep, but also the quality. Changing your sleeping position isn't always easy, but there are ways to make this transition smoother. Switching your sleeping position can indeed be a challenge, but it's a transformation worth undertaking. Transitioning from stomach sleeping to either back or side sleeping may initially seem like trying to doodle with your non-dominant hand. It's peculiar, uneasy, and you may find yourself drifting back to your previous ways in your sleep. However, fear not. It's a common occurrence, and there are tactics to facilitate this shift more bearable. Here are some tips. 1. May want to consider investing in some supportive pillows or mattresses. The right bedding can prove to be quite beneficial in altering your sleeping position, just like a suitable pair of running shoes can have a significant impact on a marathon runner. A body pillow, for example, can offer a soothing barrier that dissuades you from rolling onto your stomach. 2. It might also be useful to gently transition from stomach to side sleeping before attempting to sleep on your back. This lesser severe change might feel more organic initially. Using a pillow to support your waist and upper leg can help maintain alignment. 3. Altering your sleeping position isn't solely about the physical aspect, the psychological element plays a part too. Creating a tranquil bedtime routine that promotes sleep and makes your new sleeping position more appealing could be helpful. This routine could comprise leafing through a book, tuning into serene music, or indulging in mindfulness meditation. And remember, patience is key. Modifying a habit, particularly one you've likely had for many years, demands time. Don't anticipate mastering your new sleeping position in one night, but rather concentrate on making steady progress and commemorate little victories as they come. It's always prudent to consult with a healthcare provider for customized advice. They can offer guidance tailored to your specific needs and circumstances. After all, every individual is unique, and what is effective for one person might not be for another. Hence, do not hesitate to seek professional assistance if you're finding the switch challenging. It's all a part of the journey towards better sleep and enhanced health.